the culture of, and again, this is a bit of a hackneyed and overused phrase, but the issue of a team. Private equity may or may not be, as Refocus has been, very, very motivated to promote that concept across the board in terms of everybody who's in the office, whether it's a front office or whether it's in the clinical arena. And they certainly support continuing education and just really a collaboration among everybody, really not making distinctions between a technician and perhaps an optometrist who's in the practice or the MD. Bottom line being that everybody is really treated and needs to be treated with the same kind of respect and also sense of appreciation in terms of what they're doing.
My wife and I, we've always had a flat run organization where we work together with our management team, with our surgical coordinators, with our front desk, our scribes, our optometrists, our technicians, ourselves as physicians, and our doctors that come in and join us a couple times a month. We've always worked together to really affording our patients the best in outcomes. There's nothing class-like here. It's flat, and we are all eye care professionals. With Refocus now being a very large entity in the upper Northeast and the Mid-Atlantic area, we're lucky enough to sort of have this fusion of some great mindsets, some subject matter experts in retina, in interventional glaucoma, in ocular surface, in optometry, in ophthalmology. It's really great to have that library of physicians as we continue to grow together to really reach out to and to really help you in the pickle you may be in, or if you want to innovate. So I've gotten numerous calls from doctors, not only within our consortium, but outside, to say, Jay, I heard you give a talk. I heard you're doing this in your practice. How can I do it better in my practice? So that's shared, and it doesn't just go one way. It's for me too. That symbiosis has been incredibly important. And Refocus, by the way, fosters that. We're going to be doing something special the next couple of months, looking at how we can improve the conversion rate in cataract surgery towards doing upgrades for our patients, or interventional glaucoma, or drop therapy is just a mundane way of taking care of patients. Are there ways to be interventional glaucoma and to offer our patients more lasers or drug delivery or MIGS during the time of their cataract surgery, or as a standalone? Having such a great consortium of physicians, ophthalmology and optometry is very, very woven, and it's sort of a tight community, but we feel an extra tightness, a family here at Refocus. Lucky enough to join Refocus, it was a very strong symbiotic relationship, and we have now found a year and a half later, for the most part, things have gone great. It's gone really well. We worked terrifically well with our manager, who sort of helps manage all of our managers in the consortium. And our patients have felt nothing more than what they always desired in our practices. Doctors, staff, teams really taking care of their needs day to day. So the ability for physicians to be autonomous, to do what they do best historically, that has not changed whatsoever. And that's exactly why we did this deal with a company like Refocus. They have not micromanaged. They have not macro managed. They've helped out with some of the HR parts of running a practice and some of the mundane parts that otherwise we did not enjoy. Some of us did, some of us did not. So it's been relatively seamless and it's gone well. And now we're into year 2 and we're hoping to get stronger and better together as we continue to feel each other out and what we want to do aspirationally to help other practices grow and to help other practices that are outside of our platform join our platform. Because guess what? You have the ability to be stronger together as a group. And we truly, truly believe that.
Since we've joined Refocus, we've had a lot of benefits, added to our practice. Just more support for our back office staff, whether it's billing, whether it's supplies, keeping the office staffed with what we need. Those things have been very helpful. Also, they've been really helpful with marketing endeavors and giving us more resources for those activities, and helping us facilitate things such as lectures or CME talks for our local optometrists or other doctors, where we give lectures and up to date on various aspects of healthcare and how we can share best practices amongst other practices. So these have all been helpful additions since Refocus has joined us.
What I really like about Refocus are my colleagues and the staff. We get to really enjoy each other's company. There's a good culture. People seem to like to come to work, and that goes a long way, not just in my well-being as a doctor, but also in the well-being of patients. And so when everybody is happy, there's just a different energy that goes around in the office. And I have found that not only with my other doctor colleagues, but also with the technicians and the front desk, everyone seems to be happy to be here and excited to help the patients and make the flow of the day go well so that people get the care they need.
One of the great things about working at Refocus is definitely the colleagues that I work with. Everyone's part of a team here. We all work together, and that's one of the great things that I love about being at Refocus.
What makes Greenwich Ophthalmology special is that we are a multi-specialty practice, meaning that if I see you for glaucoma, but I notice that you have something going on in another part of your eye that's not my specialty, there's someone in the office who can treat that for you. And we are all connected, we are constantly sharing patients. And I think that collegiality and ability to do everything in one place really sets us apart.
While we have all these amazing IOLs that are out on the market, we only want to offer you ones that are best for your vision. So not every person qualifies for every single type of IOL. In the office together, we'll come up with a treatment plan and figure out what's the best way to maximize your vision, potentially without glasses. And that's how we'll choose what's the best IOL to put in your eye.
The benefit of visiting a cataract surgeon with advanced fellowship training, especially in the fields of cornea refractive surgery, such as myself, is that we can better evaluate the patient for things like astigmatism or curvature of the eye and recommend premium lens technology to them, which can reduce or eliminate the need for glasses after surgery. My take on premium lenses is they're well worth the investment. Braces or Invisalign are actually more expensive than some of the premium lens technology, and you're correcting your vision for a lifetime with surgery. I always explain to patients that when we take the cataract out, we're implanting a lens implant that stays with them generally for life.
I really love making people see better. I did my residency at Georgetown University in Washington Hospital Center, graduated in 2003, then went on to become the residency program director after that, and really enjoyed my time teaching at the same program for about a decade. I literally went from being the resident in the chair learning to the teacher literally in a day, and it just empowered me so much. You have to master it to be able to teach it. It was just a great experience to kind of propel me forward in my surgical career. It's an incredible feat of technology. It's something that seemingly would be impossible, just to operate on a human eye and turn it into something that is really less than 10-minute procedure that people tolerate. People come in after surgery the next day just amazed at what they can see. The first thing I like to do is comfort them and let them know it's gonna be fine. You're gonna be very happy with the outcome and minimal downtime. I want patients to go in informed what we're gonna be doing, how we're gonna be doing it. Not everyone's 20/20 on day one. Sometimes it takes a day or two for everything to come together. A lot of times they really just want to know what I would recommend for them. I really spend a lot of time talking to them about their hobbies, what they like to do, how they're going to be using their vision. My job is to set their expectation, make sure I deliver on that expectation.
I work alongside 2 ophthalmologists, and I treat a lot of medical cases here at both locations, as well as doing routine eye care. I see patients of just about all ages. I work with great staff who are very, very highly trained, so I'm very lucky here. Everyone here has probably worked in this industry for 10, 15, 20, 25 years. The amount of learning that they've done in that amount of time is such a tremendous help to me when I see patients, especially complex patients, that it makes everything so much easier. And it makes patient care better from when the patient enters to when they leave. So their entire experience has a sort of a high quality sense to it in a way. Just having people around me that each know their jobs so well and sort of value their ability to do their jobs well. There's a symbiosis there where we kind of feed off each other, where it ends up working great in the end for the patient. It's more efficient. The patient gets what they need in a better way, and ultimately everyone's happier.